So this is geared for patients who are starting to have a slowing of their stream or BPH symptoms.
What it does is it allows the doctor to diagnose where the patient is in terms of his bladder health and life cycle of the patient's bladder. Now, because it's so non-invasive, so easy to do, you increase in obstruction, then you're going to notice a decrease in flow, and then again, eventually the bladder will begin to fail and it can no longer provide that high pressure and it drops into a low flow, low pressure category. What the physician is trying to do is to assess where you are in this life cycle so that he can intervene so that you don't end up damaging the pump or damaging the bladder. So today we actually set the equipment up and have, this is kind of an updated device to what the doctor has been using over the last 2 years. Mm-hmm. And there's a representation of it here. But to begin with, it's called the Urocuff system. And what it does is it allows the doctor to diagnose where the patient is in terms of his bladder health and life cycle of the patient's bladder. Prior to this technology, the only way to assess this was with urodynamics, which is, as you know, a very much more invasive procedure involving catheters through urethra, through rectum, about an hour and a half, kind of time slot for that patient. With this new technology, and especially with this advancement with the disposable device here in the last 6 months, it's a very simple test for the patient. Patient can come in, essentially is urinating into a graduate, and we're able to assess the diagnostic in a five-minute urination.
So this is geared for patients who are starting to have a slowing of their stream or BPH symptoms or men with urinary issues.
Yes, exactly, yeah. I know the physicians are really excited about being able to use this in many different ways. Essentially, any patients that have LUT symptoms, lower urinary tract symptoms, they'll want this diagnostic now because it's so non-invasive, so easy to do. With new patients, it helps assess exactly where they are in the life cycle of their bladder, so it gives them that baseline. With patients that are on medications and maybe are following up with medications, it's a way of actively managing those patients. Also can be used very well to assess patients post-procedure, deobstructive procedures, whether it be a Urolift or a Resume or more of a surgical procedure, a TURP procedure, to see how their bladder is now responding post-procedure. They can come in and do this simple 5-minute test. Yeah. So if we have a little model set up here. So in terms of the patient coming in to perform the test, he's going to be brought into the clinic and he's going to be asked to step up to what looks like a urinal. Before the patient begins urinating, he's going to be asked to go ahead and grab this disposable device and he'll center it and bring it up to the center of the tip of the penis, just like this.
Okay.
There's a little lip in here that provides for a vacuum.
Okay.
The patient will hear a pump in the background that is operating this vacuum right here. And as he brings it up and centers the tip of his penis into the center of the device and brings it up to the tip of the penis, it'll create some suction and hold it in place, for the patient.
Okay.
This is very comfortable. It's just a very slight vacuum just to make a seal there. Once that happens, the patient will hear in the background that pump has stopped, and that's an indication that, okay, now you can go ahead and urinate, and he's going to urinate right through the device into a graduate and just essentially urinate normally. You may feel a little bit of pressure because there's in the actual device that's being used, this is a demo, there's a foil in here that will squeeze against the patient's flow, which is how we're able to assess bladder pressure. And then the flow is captured on a scale, which is how we're able to assess flow. And with those two data points, then we can plot the patient in terms of where he is in the life cycle of his bladder.
And to clarify, that pressure is being applied on the urine stream as it enters into the channel, not on the patient themselves, so they don't notice any increase of discomfort or anything during the procedure.
That's exactly right. Most all patients, with the old device, the old classic device, we used to have to bring the urine flow to a complete stop, which provided for a little more discomfort than you have with this new device, because you had an increase in back pressure against
Correct.
the natural flow.
Right.
But with this device, with most patients, we only have to increase the pressure to what we call 60 centimeters of water pressure, which is not enough to stop the flow. So the patient may experience a little bit of back pressure, but it every 3 seconds it increases and decreases to zero, increases, decreases to zero. So you're kind of just slightly aware that there is some pressure there as you're completely voiding your bladder. Yeah.
Wonderful.
Yeah. And then in terms of the diagnostic, so once that's performed, then we're able to print out a diagnostic. So this is a 3-page diagnostic that the physician, excuse me, the physician will be discussing with you. It's basically broken down into 4 quadrants. This is a normal flow, normal pressure. You're moving into a normal flow, higher pressure up here where this patient indicated. From there, in terms of the life cycle of the bladder, you'll move into a lower flow, high pressure patient. And then eventually, as the bladder begins to fail more and more, you'll diagnose as a low pressure, low flow patient. And so if I just switch diagrams here. So what this diagram is showing is, in essence, the life cycle of the bladder. As we start, again, young and healthy, we have a lower pressure bladder and normal flow. As we begin to age and with BPH, with obstruction, you're going to move into where you're able to maintain a normal flow, but the pump, the bladder, needs to increase its pressure in order to provide you with that normal flow because of obstruction. And so you can think of that as if you were to squeeze down on a water hose and decrease that pressure in order to maintain the same flow coming through that water hose. You would have to increase the output, the pressure of the pump, right, to maintain that. So as a patient moves from normal flow, normal pressure into high pressure, high flow, the reason you have a higher pressure bladder at this point is because it's trying to compensate for an increased obstruction. And in order it's, the bladder's trying to push harder so you can have the same flow with obstruction. Eventually, what's going to happen is as you have more and more obstruction with BPH, the bladder cannot compensate anymore. It is at its maximum, capable pressure output. So as you increase in obstruction, then you're going to notice a decrease in flow. And then again, eventually the bladder will begin to fail and it can no longer provide that high pressure and it drops into a low flow, low pressure category. So what the physician is trying to do is to assess where you are in this life cycle and to take appropriate actions so that he can intervene with some type of procedure so that you don't end up damaging the pump or damaging the bladder.
So this is an essential test that we perform in the office to give us an idea to tailor what specific procedure a particular patient would be viable for or would work best for them. Correct?
Very much so.
Right.
Yeah, very much so. Yeah.
Awesome.
Any other questions?
It seems pretty straightforward. I'd like to put it into use and see what we come up with.
Great, yeah. And urology, Fairbanks Urology has patient educational brochures and other information for you so that, you can basically reiterating what I shared with you, here today. Yeah.
So they've got something tangible that they can look at so they feel comfortable with the procedure before having it performed.
Exactly right.
Right,
Yeah,
that's awesome.
Exactly right, yeah.